Before you start taking Ibrutinib, make sure to read the patient information leaflet and instructions for use from your pharmacist. Take this medication by mouth, usually once daily, at the same time each day to get the most benefit from it. Shake the bottle well before each dose and use a special measuring device to carefully measure the dose. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. It's important to not increase your dose or take this medication more often than prescribed. Avoid eating grapefruit or drinking grapefruit juice while using this medication, as it can increase the chance of side effects. Additionally, since this drug can harm an unborn baby, women who are pregnant or may become pregnant should not handle this medication. Some common side effects of Ibrutinib 70 mg per milliliter oral suspension may include upset stomach, diarrhea, nausea, vomiting, decreased appetite, headache, joint/muscle pain, swelling of ankles/legs/feet, numbness/tingling of arms/legs, anxiety, constipation, dizziness, or tiredness. However, many people using this medication do not have serious side effects. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. This medication may raise your blood pressure, so it's important to check your blood pressure regularly and tell your doctor if the results are high. If you experience any serious side effects such as easy bruising/bleeding, dark/tarry/bloody stools, fast/irregular/pounding heartbeat, unusual tiredness, or signs of infection, it's crucial to tell your doctor right away. In some cases, Ibrutinib may cause side effects due to the rapid destruction of cancer cells, so your doctor may add a medication and tell you to drink plenty of fluids to lower your risk. Consult your doctor for more details, and get medical help right away if you have any very serious side effects such as chest pain, signs of bleeding in the brain or a stroke, or a serious allergic reaction. And remember, this is not a complete list of possible side effects, so always contact your doctor or pharmacist if you notice any other effects not listed above. Before starting Ibrutinib, it's important to let your doctor know if you have any allergies or if you are allergic to this medication. Also, discuss any other medical conditions you have, such as heart problems, high blood pressure, kidney or liver problems, or if you have a history of bleeding or infections. Be cautious when using sharp objects and avoid contact sports to lower the risk of getting cut or injured while taking this medication. Additionally, talk to your doctor before getting any immunizations or vaccinations, and let your doctor know if you are planning to have surgery. If you are pregnant or planning to become pregnant, it's crucial to discuss this with your doctor before starting Ibrutinib, as this medication can harm an unborn baby. Both men and women using this medication should ask about reliable forms of birth control during treatment and for 1 month after the last dose. Breastfeeding is not recommended while using this drug, as it is unknown if it can pass into breast milk and harm the infant. Make sure to consult your doctor before breastfeeding if you are using Ibrutinib. It's important to be aware of potential drug interactions with Ibrutinib 70 mg per milliliter oral suspension. Some medications can change how this drug works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ibrutinib include other drugs that can cause bleeding or bruising, such as antiplatelet drugs like clopidogrel, NSAIDs like ibuprofen or naproxen, and blood thinners like warfarin or dabigatran. Aspirin can also increase the risk of bleeding when used with Ibrutinib. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Other medications, such as certain antifungals, HIV protease inhibitors, and antibiotics, can affect the removal of Ibrutinib from your body, which may impact how it works. Be sure to consult your doctor or pharmacist for more details about potential interactions. If someone has taken too much Ibrutinib 70 mg per milliliter oral suspension and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with others. Your doctor may also require you to undergo lab or medical tests, such as a complete blood count, kidney/heart function, pulse, or uric acid levels while you are taking this medication. Make sure to keep all of your medical and lab appointments, and consult your doctor for more details. If you happen to forget to take a dose of Ibrutinib 70 mg per milliliter oral suspension, take it as soon as you remember on the same day. If it is the next day when you remember, it's best to skip the missed dose. Then, take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. When storing Ibrutinib 70 mg per milliliter oral suspension, make sure to keep it in the original container either in the refrigerator or at room temperature, away from light and moisture. Do not freeze it and avoid storing it in the bathroom. It's important to write the discard date, that is 60 days from the day the bottle is first opened, on the label, as mentioned in the instructions for use. Remember to keep all medications out of reach of children and pets. When it comes to discarding the product, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you have any questions about the proper way to dispose of the medication, consult your pharmacist or local waste disposal company. As for the optimal timing and daily dosage of Ibrutinib 70 mg per milliliter oral suspension, it's important to follow the instructions provided by your healthcare provider. This medication is used to treat certain types of cancer and should be taken exactly as prescribed. Be sure to take it at the same time each day to maintain a consistent level of the drug in your body. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.